Hi, I'm Dr. Eric Hanley, one of the surgeons here at the St. Mary's Bariatric Program. You've just heard from our medical director, Dr. Hanish, a little bit about our program and our program's philosophy, and then also about some of the problems that lead to obesity. What I'm going to talk to you about in the next few minutes are some of the health concerns that come about in patients with morbid obesity, and as way of sort of an explanation for why we would consider something as radical, if you will, as surgery for the treatment of this disease. First of all, I think it's important to recognize the magnitude of this problem. We know that in the United States, every year there are over 300,000 premature deaths attributable to obesity. This makes obesity the #2 cause of preventable death in the United States. And this is second only to cigarette smoking, which we all know the health problems concerned with smoking. The scary thing is that fewer and fewer people are smoking, and more people are suffering from the disease of obesity. So it won't be long before obesity is the #1 cause of preventable death in the United States. We know that in addition to all of the health problems that occur as a consequence of obesity, we also know that obesity shortens the life expectancy of a patient. This slide here shows the relationship between death and body mass index. This was a study published many decades ago that showed that as a patient's body mass index rises, so does their risk of death. And as you can see, as you reach the top of this curve at a body mass index of 40, a patient's risk of dying in that given year is 2.5 times the chance of someone with a normal body mass index. The really scary thing is that the curve doesn't stop here. While our graph stops here, the curve continues to go up. And so our patients with body mass indices in the 50s and even 60s are at even greater risk of death as a consequence of their obesity. Now that's bad news, but the news gets even worse because we know that obesity affects virtually every organ system in the body. Here you see a picture that shows the many organ systems that are affected by morbid obesity. Some of the more common things that we see are high blood pressure, obstructive sleep apnea, liver disease, diabetes. The list goes on and on. You can see that there are a number of cancers that have been linked to obesity, problems with gallbladder, infertility. There's virtually no organ system in the body that isn't affected by morbid obesity. So hopefully that gives you a picture of the magnitude of the problem. Obviously, the first thing that we consider as a treatment for patients with obesity are the things that you've heard about and probably tried many times in the past, things like diet and exercise, enrollment in a weight loss program, even use of medications or counseling to try and help with weight. We like to consider bariatric surgery or weight loss surgery as kind of the last resort, the thing that you try when all the other treatments have already failed. Now let's take a look just briefly at how effective diet and exercise really are. This is a study published in the New England Journal of Medicine that showed the effectiveness of various diets. The curve in blue shows the low carbohydrate diet or the Atkins diet. And in general, over the last couple of decades, that diet has been proven to be the most successful in helping patients to lose weight. You'll also see in yellow the Mediterranean diet, and this was the study that showed that things like olive oil are good for you. But as you can see, over time, and this study followed patients with obesity out for 2 years on these various diets, you can see that over time, the amount of weight lost in the scale here, it's in kilograms, but the best that they saw in their patients was about 5 kilograms of weight loss long term. That's about 12.5 pounds. Now, if you're 15, 20 pounds overweight, that's a great result. But if you're 50, 75, 100 pounds overweight, 12.5 pounds hardly makes a difference. This next slide shows you what I believe to be the best ever published non-surgical weight loss study. And in this study, they randomized patients to 4 groups. I'm really only going to focus on one group, and that's the curve at the bottom of the graph. These are patients with morbid obesity who were enrolled in an intensive counseling program where they saw their physician at least once a month. They came to weigh in every 2 weeks. They were placed on an appetite suppressant, which was monitored by their physician. And then they also received intensive nutrition counseling so that they understood what was healthy to eat, what not to eat, etc. And what you can see is that over time, they followed these patients for a year. The patients in that intensive group lost about 20% of their excess weight. That's what EWL stands for, excess weight loss. What that means is for patients who are 100 pounds overweight, they lost and kept off at about a year 20 pounds. So how does that compare to surgery? This is a graph from the Swedish obesity study, which is probably the most talked about study in the world of bariatric surgery. And in this study in Sweden, which included all morbidly obese patients in Sweden, they looked at different groups. They compared how patients did without surgery to patients who had surgery. And I'll go over the results of surgery in a minute, but if you take that best ever non-surgical weight loss study and you plot it on this graph, you see that patients lost, as I mentioned, 20% of their excess body weight. If you assume that those patients kept that weight off for the next 14 years, which I'm sure most of us would agree is unlikely, but if they did, you can see the red line indicates where those patients would compare to the surgical groups. Now, here on the bottom part of this graph, you see 3 lines. The orange line represents patients who had a lap band. The purple line represents patients who had a procedure called the vertical banded gastroplasty, which is not a procedure that's performed anymore. And then the bottom line are patients who had a gastric bypass. That's the line in green. What you can see is that all of the surgical groups over time outperform diet and exercise. Gastric bypass in particular over time yields patients a weight loss equivalent to about 70% of their excess weight. So again, if the patient is 100 pounds overweight, that represents losing and keeping off about 70 pounds long term. Now, weight loss is great, but what we're really looking for is an improvement in your health. And so this next slide shows, again, you saw before the organ systems that are negatively affected. This is how weight loss surgery affects in a positive way each of these organ systems. To highlight a few, you'll see that patients with type 2 diabetes, about 83% of patients after bariatric surgery will find that their diabetes goes completely away. Over half of patients with high blood pressure or hypertension will find that their high blood pressure completely resolves. Obstructive sleep apnea, depending on how you measure results, but at least 3/4 of patients with obstructive sleep apnea get rid of their CPAP machine. You can see again that virtually every organ system is affected in a positive way after bariatric surgery. And I love to quote Harvey Sugarman, who was one of the past presidents of the big Bariatric Surgery Society. He was talking about gastric bypass, and he put it this way. He said, "Gastric bypass for morbid obesity is a treatment like no other in medicine, as a single surgical procedure can cure 4 or 5 of the patient's health problems. This is why I love doing bariatric surgery and why I love coming to work every day, because in the other part of my life, in general surgery, I might get the chance to treat one condition at a time. But when I'm performing bariatric surgery, I know that I'm treating multiple problems all at once." Now, I gave you some pretty bad news at the beginning. I'd like to end my section with some very good news. And that is that while we know that obesity is a major risk factor for premature death, we also now know that bariatric surgery or weight loss surgery helps to get those years back. So this is, again, from the Swedish obesity, shows that patients who had bariatric surgery cut their risk of death in half compared to patients who didn't have surgery. So hopefully you have a better idea now of the magnitude of the problem of obesity, and also a better sense of why we use surgery as an effective tool to treat the disease. In the next section, Dr. Shao is going to describe the various surgical procedures that we offer here at St. Mary's Hospital.